Subscribe to our YouTube channel and press the bell icon to get the latest updates.
We have built a number of horizontal service delivery components by way of these public digital goods. Now, what is going to happen is that we are going to utilize and leverage these goods and also create a number of other digital public goods in the health space so as to provide quality, accessible and affordable healthcare to our citizens. And the Ayushman Bharat Digital Mission, launched by our Prime Minister on 27th of September this year, is the one which is going to play an extremely important role in this journey. So during the last 1 year, because he had announced a pilot on 15th of August 2020, we have been experimenting and developing new, sort of stack components. So one is the health facility registry, which essentially will work as a reference registry for the health facilities in the country and which can be used by any application to locate the facilities, what are available, what is the bed capacity, what are the other details of those facilities. Similarly, we are going to have the health professionals registry, which means the registry of the doctors, the vets, the nurses and the ANMs and ASHAs and all the health workers of various categories. So that will, help people in locating the nearest doctor if they have to, go to visit a doctor and stuff like that. Similarly, we want to have the personal health record registry in the sense that we want to have a PHR application, which will basically mean that one will be able to get a horizontal view or a longitudinal view of his or her health records. And that we have created the health ID, which will work like a health account, which essentially one will be able to see the records. And it is all based on privacy and consent by design. So therefore, the owner of the data, which is the person to whom the health records pertains, he or she will be the one who will have the full control on those records. So I think all these things together are going to create an interoperable system, which will essentially ensure that we are able to connect the client applications with the facilities, with the providers, and with the laboratories, with the hospitals, etc. And in a manner which is completely interoperable, completely non-discretionary, and completely open. So this we are calling it Unified Health Interface. Now, Unified Health Interface will basically work in an open and transparent manner, wherein the various applications will be able to be plugged to provide citizen services. And of course, the teleconsultation or the digital consultation or telemedicine, whatever you call it, will be an important part of it. This will ensure that the geographical boundaries will break, which means a patient sitting in remote area will be able to connect with a doctor sitting in Mumbai or Delhi. That's number one. Number two, he or she will be able to pay the doctor using the UPI, using the digital, payment transactions. He or she will be able to, accumulate or see his or her health record using the PHR application. Then he will be basically able to get the prescription from the doctor, which will be digitally signed using the e-sign facility, which the country has developed. So therefore, all the tools are already available for us to activate this ecosystem. And the specific tools, especially relating to the health space, has already been built. And I explained them to you, the PHR, the health facility registry, the drug registry, for example, is another very important component where we will be able to put the list of entire drugs along with their prices, along with the formulae and the equivalents and all those things, so that people are able to buy cheaper drugs, generic drugs, or whatever drugs they want to buy. So I think those things will ultimately work in tandem and will work to provide health services to our people.